hemisection of the spinal cord is known as brown sequard syndrome. Here in the diagram, we can see that the blue uncrossed fibers are the posterior column or the dorsal column fibers, and the red crossed ones are the spinothalamic tracts. The posterior column fibers carry the sensations of fine touch, tactile localization, tactile discrimination, vibration, stereognosis, and the spinothalamic tracts carry the sensations of crude touch, pain, and temperature. We have lateral and we have anterior spinothalamic tracts in the respective anterior and the lateral regions of the spinal cord. So here there's an injury which is the hemisection of the spinal cord, which can occur due to the injury where the spinal shock is very immediate. So on the injury side, you can see that the posterior column fibers are cut and the spinothalamic tracts of the opposite side are cut. So below the level of the lesion, you lose the sensations of the posterior column fibers, and on the opposite side you lose the sensations of the spinothalamic tracts. So below the level of the lesion, on the same side, the sensations lost are fine touch, tactile localization, tactile discrimination, vibration, and stereognosis, and the sensations retained are the ones carried by the spinothalamic tracts, that is crude touch, pain, and temperature. But on the opposite side, below the level of the lesion, you lose the sensations carried by the spinothalamic tracts, that is crude touch, pain, and temperature. The sensations retained are the ones carried by the posterior column fibers. But at the level of the lesion, on the same side, you'll have complete anesthesia, because at the level of the lesion, the posterior column fibers and the spinothalamic tracts on the same side are lost at the level of lesion. So you'll have complete anesthesia on the same side. But on the opposite side, you lose the sensations carried by the spinothalamic tracts, that is crude touch, pain, and temperature, and the other sensations carried by the posterior column fibers are retained. Below the level of the lesion, type always resembles the human type of lesion, where you will see increased tone, spastic paralysis, loss of superficial reflexes, and exaggerated deep tendon reflexes, Babinski positive, rigidity in the limbs, and there's no muscular wastage. And at the level of the lesion, always resembles the element type, that is loss of muscular tone, flaccid paralysis, loss of all the reflexes, wastage of the muscle, and loss of vasomotor tone. It's really easy to understand the brown sequard syndrome once you see the diagram and read about it, and also know about the tracts, their roots, the sensory and the motor tracts. Then it will be easy to understand the brown sequard syndrome or any other syndromes for that matter. Next, I'd like to say a rhyme to remember the root values, and so it goes like 1, 2, buckle my shoes, that is 3, 4, kick the door, 5, 6, pick up the stick, 7, 8, shut the gate, 9, 10, a big fat hen. This is a nursery rhyme through which you can remember the root values. So 1, 2, buckle my shoe, that is ankle jerk, you'll buckle my shoe, remember like that. So it is S1 and S2. 3, 4, kick the door, so you'll use the knee, so it is a knee jerk, that is root value is L3, L4. 5, 6 is pick up the stick, biceps jerk, that is C5, C6. 7, 8, shut the gate, that is triceps jerk, that is C7, C8. 9, 10, a big fat hen, that is a beaver sign, that is T9 and T10. When you ask the patient to flex the neck, the umbilicus moves upwards, that is known as beaver sign.